Hi everyone, my name is Sam Yancey and I am a senior health science major here at Truman State University.
My name is Ellie Cott. I am also a senior health science major.
And I'm Maddie Wilson, and I'm also a senior health science major.
So for our research project, we focused on the effects of COVID-19 pandemic and what its effects were on the mental and physical well-being of Truman State University athletes. So the lack of structure and schedules, withdrawal from competition play, and from their teammates, and lack of exercise really raised a question to us about how it has affected Truman's athletes. So for our analysis, we used two different data sets from Truman. The first data set we used to represent pre-COVID data was a 2018 MOCB data set, which this stands for the Missouri Assessment of College Health and Behaviors, and data points to demonstrate post-COVID conditions were used from the 2020 MOCB data set that was distributed last November of 2020. Then we used Minitab software that was then used to test the significance of the data questions in categories like mental health, alcohol intake, and drug misuse.
The data within the MOCB was split into two groups, which is athletes and non-athletes. In order to hone in on the focal point for our research, we did focus only on the athletes who participated in the survey. As stated previously, the MOCB-A from 2018 and 2020 were used for raw data in different health and wellness categories. In each respective year, there were 92 and 134 Truman State athletes that did take the survey. The split among gender was 45% male and 55% female in 2018, while in 2020 it was 40% male and 60% female. In either year, the age of the participants fell between 18 and 23 years old. In order to create data that was statistically manageable, questions were reframed as yes or no, where occurrences of a given behavior were considered yeses. After collecting this data, a two-sample test of proportions was used multiple times to check for statistical significance in any change that occurred between pre and post-COVID. In order to make sure that results remain consistent in terms of significance, corrective stats were also used.
So as for the results, after running the two-sample test of proportions and the 95% corrective stat test, we found that 4 out of the 9 areas that we were concerned with did test significant and were impacted as a result of COVID-19. In regards to the mental health of Truman State athletes, we did have 3 major areas of focus. Those were feelings of major depression, feeling of anxiety, and development of eating disorders. The feeling of depression from 2018 to 2020 had a 4.03 decrease. However, this did test to be insignificant as a result of COVID. The biggest increase over all mental health categories was seen in eating disorders. In 2018, there was 4 reported cases of athletes experiencing an eating disorder, and in 2020, this rose by 7.7% to 16 cases amongst athletes. Though there was a significant increase, there was still no significance found as a result of COVID. Lastly, in mental health, anxiety decreased by 2.9% amongst athletes. This decrease again showed no significance after the corrective stats. In our second area of focus, we did find some significance. Our first question regarding alcohol that was asked said, how many days in the last 2 weeks has one consumed alcohol? The options given for this question were 0 days, 1 to 2 days, and 3 to 5 days. And after statistically analyzing, we found that there was a 5.1% increase, 8.2% increase, and a 12% decrease, respectively. And after corrective statistical analysis, it was found that the increase in 1 to 2 days and the decrease in the 3 to 5 days was in fact significant due to COVID. However, it couldn't be concluded that the increase in 0 days was a result of COVID-19. Our last area of concern for Truman athletes was drug misuse. All areas studied did see a decrease, and the first question we analyzed was stimulant use. Stimulants are things like Adderall, Ritalin, Dexedrine, and Concerta. The 7.7% decrease we saw in stimulant use was found to be significant. And then the second question we had was regarding the use of pain medications. These can be like Tylenol 3, Vicodin, or morphine. Here we saw a 6.7 decrease in the use of pain medication, which was tested to be insignificant. However, lastly, we tested the significance of the 13.4% decrease in any prescription drug use without a doctor's prescription, and this did test to be significant.
So as far as our conclusion goes, after running statistical analysis, we found conclusive evidence indicating that COVID-19 may have influenced the drug and alcohol use of Truman State athletes between 2018 and 2020. Altogether, student athletes are subject to all kinds of stress, such as maintaining eligibility with full course loads, meeting competition and practice expectations, injuries, and balancing social and leisure activities. The average Truman student is already stretched pretty thin, and that being said, student athletes are constantly looking for ways to cope with their stress while trying to find a healthy balance. As many of you know, COVID-19 has completely changed the college experience since Truman went virtual in March 2020. The way we learn, engage with our community, allocate our resources, and connect with each other has had to adapt given the pandemic. More recent studies have reported that youths who face life disruptions during COVID-19 were found to have higher levels of perceived stress. Perceived stress is defined as a level of individual stress given a life situation. Pairing COVID-19 stress with student athletes' increased susceptibility to both physical and mental exhaustion, we can try to better understand why we saw such variation in our results. Looking at decreases in bad health habits, including drug use, depression, and anxiety, could have to do with the student athlete's inherent capability to manage stress. Stress coping skills allow individuals to mitigate the effects of life's disruptions on perceived stress. Therefore, college students with active coping skills are more likely to graduate and less likely to have suicide ideation. When looking at negative health behaviors that increase, such as eating disorders and alcohol consumption, we also had to examine the perspective that college athletes who experience high levels of stress are more likely to practice bad health habits. Based on this evidence and our research findings, it's conclusive that more research needs to be done before we can directly correlate changes brought about by COVID-19 with changes in Truman State athlete behaviors. So, given our study, we had a lot of limitations, the biggest being the generalizability of our data given our small sample size. So there's less than 500 student athletes at Truman, and it was hard to make sure that we had equal representation across all the sports in our survey results. The phrasing of the questions asked on the mock B may also have been too vague. These questions that we investigated could be more specific and include level of severity markers, and could also give explicit definitions stating what qualifies a given answer. Despite these limitations, the intention of the study is just to serve as a foundation for further evaluation of student-athlete college health behaviors. Implications moving forward: as far as our future research goes, it may be helpful to investigate the differences between mock-B survey time administered and changes in health behavior data. It's important to evaluate health behavior data related to drug and alcohol use periodically to identify trends at large over time in order to successfully address them. Additionally, it would have also been nice to include more mock-B questions and data points in our statistical analysis. Now that we know the implications into statistical software, it wouldn't be hard to expand the study to include more information on other drug and alcohol-related questions. For future mock-B surveys, including a spot for qualitative responses regarding how COVID-19 influenced the school year for Truman students would also help us better understand how to address and supplement the changes. Moving forward, there are always improvements to be made upon student wellness and resource availability.
We would like to thank Dr. Daly Moore and Dr. Donahue for their advice throughout this project, as well as Dr. Thatcher and Case at Truman for guiding us through the statistical analysis.
Thank you.
Thank you.